So the purpose of this video is to run through the different accessories available on the radial Shockwave. So we have the radial handpiece and we have the V-actor handpiece. We also have a number of transmitters which we're going to go over as well. So the standard transmitters that come with the radial Shockwave machines are the RO40, the Deep Impact 15 and the D20. There's some key differences between these three. The first two look very similar in shape because they are. The RO40 and the DI15 are simply made out of a different material and are very subtly a different shape. These are most commonly used in the treatment of the tendon or very locally over trigger points. The third transmitter, the D20, is quite different in that if you unscrew the cap, what you'll see is you've got several red rings. These red rings create a vibration and an oscillatory movement, and what we find is the D20 is best used on the muscle tissue and myofascial trigger points. The second handpiece you can attach is the V-actor. With the V-actor, you don't use any gel, there is no shockwave being emitted out of the device. It is a mechanical massage tool. There's two different sized heads, the V25 and the V40. You would change these depending on the surface area of the muscle you're treating. The V-actor is very good to use as a desensitizer before shockwave, particularly if a patient is nervous or apprehensive about the treatment. In addition to the standard transmitters that we use with the radial handpiece, we have some additional transmitter heads. The most commonly used would be the D20T, which is the same setup as the D20S, but with a different material. The wave propagated allows a deeper, stronger intensity to the tissue, still used in a muscle setting. The D35, this is commonly used in the treatment of cellulite. The Focus 15 is commonly used around the head, face, TMJ and other sensitive areas. All transmitters are compatible with both the Chattanooga and the Storz medical handpieces.